Hi, I'm Dr. Ellen Lee. I'm the Director of Palliative Care here at Swedish, and I'm standing here at the First Hill campus in the Palliative Care and Symptom Management Clinic. Palliative care is a specialty of medicine that concentrates on symptom management and discussing goals of care conversations with patients who are suffering from serious illness. While it is related to hospice, we are not the same thing. Hospice can only be accessed in the last 6 months of life, while palliative care can be accessed anytime in the disease trajectory. We had a patient with severe back pain, nausea, poor appetite, insomnia, and fatigue. He would go to the emergency room or the treatment center at least twice a week to receive IV pain medication. And even though he went to these services, he never received good pain control or symptom management when he left. He was too sick to work or to have any further cancer treatment. Once he had back surgery to get the pressure off of his spine from the cancer, and then treated with high-dose pain medication in the controlled setting of the home and at the hospital, all of his symptoms resolved. He was on 1,000 milligrams of oral morphine equivalents per day, so that's why we were giving him the pain medicine in the clinic, which was not working. His other symptoms were really all tied to the uncontrolled pain. Now he is gaining weight, all of his symptoms are resolved, and he's actually completely weaned off all of his pain medication and has returned to work. If he were to want more chemotherapy or further anti-cancer therapies, he would be a candidate. We had another patient with liver cancer in the backdrop of liver disease. She decided that she could not bear the thought of a liver transplant because she had a family member die of a liver transplant. She felt that type of death was not acceptable to her. She suffered from pain in the abdomen, nausea, poor appetite, and swelling in her abdomen, as well as in her lower extremities. She followed with palliative care to help alleviate some of these symptoms, as well as the liver clinic. I just want to know from you kind of who sent you over and what you were expecting from our palliative care clinic visit today.
Well, my primary physician made the referral,
Okay.
and she had been treating me for some symptoms, but felt that I needed more care,
Okay.
and so she referred me here.
Okay.
But I'm not sure exactly what palliative care is, so
Okay.
I'm a little nervous about that.
Okay, so I understand that you have liver disease, and so in the case of liver disease, in your situation, it's a pretty serious illness. It's not something to be taken lightly. And we deal with serious illness, and I know you have a lot of symptoms stemming from that serious illness. And so we provide kind of an expert symptom management on top of what your liver specialist does, on top of what your primary care does. We really hone in on those symptoms. That's our primary focus, is how do you feel? On top of that, we talk about goals of care. And so I know I read a note from you that said your brother had had a transplantation of his
Right.
liver, and you have very definite feelings, strong feelings about transplant.
Right, yes.
And so we talk about that. We talk about what goals you have for your health care. We talk about difficult decisions. In your situation, you made a very difficult decision on your own, but more difficult decisions will come as you get sicker down the road. And we want to make sure that the care that you receive is tailored to you, and it's really what you want, and you understand what choices you make and what consequences occur from those choices. So it's a way to make decisions, but be very clear about what that decision will mean for you. Okay? So we have a whole team of people that help with that. So it's not just me. You met Mary, my nurse. We have a social worker in clinic. We have a nurse practitioner who assists. And so we have a team of people that handle phone calls from you. We'll talk about medication management, talk about your housing situation. I know there's been some stress around that. So I know we covered a lot today. I mean, we talked about your symptoms. We talked about goals. You don't have to worry about remembering everything. Okay, we're going to go over this stuff again and again and again, and we'll do it step by step. Okay?
All right.
Ask your doctor for a referral to the Palliative Care and Symptom Management Clinic if you are suffering from symptoms that are not being managed, and if you're having symptoms that are related to your disease or to the treatment of the disease. For more information, call our clinic at area code 206 386 2126.